For now, I'm going to welcome my next guest into the studio. So we've got a clinical strategy consultant from ETC Health at BT. It's none other than Dan Bunstone. Dan, welcome to the studio.
Thank you very much indeed. Good to see you.
And welcome. Tell us a little bit about you. Tell us a bit about your job, your role, and what's going on for you at the moment.
Of course. So I'm a GP by trade. So I've got a surgery in Chapelford, which is in Warrington, Cheshire Merseyside ICS. But as part of my role, I'm also a clinical director for a PCN, and I work in Etc. Health for BT. So we're creating health apps, enabling people to lengthen their health span, not just their lifespan. It's around enabling people to live longer, but giving them the power to do that.
Okay, and is that within the NHS, the apps, or is that something you're doing privately, and how does that work?
A little bit of both, really. So we're running a project across Warrington currently where we're helping patients better manage their hypertension, but the app's a proprietary app that we're making inside of Etc. Health for use. People can use it now and download it. It's all about enabling people to make lifestyle changes that are impactful.
What does the app do? It sounds intriguing, but give us an overview of the app. How does it work? How does it actually help people?
Yeah, for sure. So I think what you would do with the app, you would download the app, and of course it will then give you advice based on what you input. So it'll ask you details around your BIOS, your age, your height, your weight, and then very importantly things around nutrition, blood pressure, and then moving on to things like cholesterol, etc. And from that it'll give you advice that will then most impact on your ability to live your longest, healthiest life. There's lots of data, there's lots of resources out there, but actually what we're trying to do is really add a scientific approach to it. So the 3 lifestyle interventions that are going to have the most impact for you. And simple things like if you're already walking 3,000 steps a day, did you know that by walking 4,000, you will decrease your chances of bad things happening to you, ill health, long-term conditions? It's about empowering patients or citizens.
Well, and is that like linked directly to the doctors, or is it you literally put in all your stats and it works it all out the cells? Like, how does it work sort of back end? And
yeah, exactly right. Good question. So it's both in many ways. So it's a standalone piece where people can get their own information, but it can also feed back to their GPs, to all their clinics. So what we've got in Warrington is we've got a team that better manages people with high blood pressure that's not been managed well in the past. So we've done some searches. We've already treated around an additional 650 patients to target that weren't to target, which we think's probably saved around 30 heart attacks and strokes.
Oh,
really
wow.
big impact for patients. And just talking about money for a second, massive impact for the economy too.
Fantastic. And is it just a sort of trial in Warrington at the minute, or is it going to be countrywide, or is it what sort of stage you'll be at?
Yeah, good question. So with the app is nationwide. Of course, it's now free on the App Store to use.
Okay.
We're trialling the clinician side in Warrington. So thankfully, our ICS has been very forward-thinking, so everybody's talking around proactive care, population health management. Cheshire Merseyside invested about £250,000 for us as a clinical network to deliver that for our patients. So we utilise the app, but actually we've got a clinical team delivering that care too.
So what's your background then? How did we end up developing this app as such?
Yeah, so for sure. So I've been a GP since about 2008. I was chair of a CCG, Warrington CCG. Then I moved over to Push Doctor. Push did the video consultations, if you remember, similar to Babylon, similar to Livy, where you'd have a consult via a video tech. I was their chief medical officer for 4 or 5 years. And then from Push, I moved into app development over at BT and Etc. Health.
So you're still a GP as well, or?
Yeah, so I do a day a week as a GP, and I'm also a clinical director of a PCN too. So busy life, but actually as a Venn diagram, it's great because all of the things overlap and are really helpful for each other.
Fantastic. And how's it been received from like the public, the end user perspective, and clinicians as well? How's it really helped them?
So patients love it. We've completely enabled them to reimagine their relationship with healthcare. So rather than them phoning us when there's something wrong, we now phone them to say, listen, we're trying to avert this thing happening to you. Here's what you do. So with our consults, around 80% of our consults have enabled patients to control their blood pressure without anything but lifestyle advice. Some compliance stuff, so they were prescribed it and not taking it. GPs and of course clinicians like it too, because it's enabling them to help to treat their patients better. Better, healthier patients means less long-term conditions. Ultimately, it's trying to really move us from treating illness to enabling wellness.
So what was your inspiration? Did you see the need and then develop the app for it, or did you sort of develop the app and then people were like, this is fantastic, or how did it, which came first, if you like?
It's sort of evolved really from virtual wards, if I'm honest with you. So we were thinking around virtual wards and how we get hospital avoidance, etc. And actually what we wanted to do was just do a complete left shift. we often talk about lost populations and underserved patients. I think we've got a hypothesis where actually, and certainly as a male patient, between the years of 15 and 45, to pick some generic years, you probably don't touch healthcare in a meaningful way at all. So we lose you at 15, and at 45 you arrive back with chest pain or hypertension or diabetes.
The long list of unresolved issues.
Quite, so we want to close off that gap. So we spotted the need and we evolved it from virtual wards and thought, well, actually we'll inhabit a space which is really far left, which really enables everybody to deal with it and helps them get on top of their health. The world is moving in that direction.
I think it is. We've spoken briefly about AI and various technological advances and stuff, and like, do you really believe that is the future then? Do you think the app space, use any AI in it?
We do. It uses AI at the moment, so that's the bit we're growing and developing, so that the thought is that ultimately we'll get a really clear view of you as a person, including blood tests, blood pressure, and things that you've put in there, some additional bits. So there's the bits you know, like your height and your weight and your diet and your exercise. It'll pull information off the wearables too. So ultimately it gives you a really clear picture of you. Then we can give you the best advice to make you the best version of you can be. And the AI plugs all that stuff in. So if you've stepped up your step count for those last 2 weeks, actually then it knows the thing that you need to do next might be some more strength training, or it might be to eat 7 fruit and veg a day. It will modify based on what you write in.
Clever. It's clever.
Very clever stuff.
And in terms of the actual show today, have we got you speaking anywhere? I'm not sure if you're speaking or not. Have we got you any of the stages?
Not today. I was going to be on the on the first show with Claire and Amanda this morning, but of course with Purdon and that sort of changed things a little bit. No, it's a lot of looking around. It's a lot of networking. It's lots of meeting new people and actually just seeing what's out there, which is amazing.
Tell us about what you've seen. I'd say, have you been out there in the show networking and speaking to people this morning? What have you found? Anything new, exciting that you've got?
Yeah, so as a PCM, we're trying to create hubs. So using AI, so we've got conversations going on with Anima, which we've really liked as far as the triage piece goes. AbTrace is another conversation we're having around looking at our data. What we want to do is make decisions that are really data and clinically based on need and not just want. And our hypothesis there is that if we can deal with need and people in the most need of clinical services, actually that is the best way of managing situations. That will help our demand curve too. We're starting to see that already with the additional roles that we've got in. We've just set up a hub. We've got a system hub with TPP, and we're just about starting the triage hub with Anima. So things are moving in the right direction. It's great.
Okay, and in terms of the app moving forward, what's the next step with it? Is it national rollout? Is it awareness? Because I've not heard of it personally. It's like,
sure.
Why haven't I heard of it? How are we going to get this if it is that has so many benefits? Where do you see the sort of progression of it, if you like?
Naturally, it's going to be aimed at end user. I think that's the point. So it can support and it can augment clinicians in the NHS, but actually it's got the dual purpose where we've gone through the proof of value and proof of concept stages. Now we're into rollout. It's available in the App Store. Go and download it. Healthy You. Have a look. See what you think. It's in there and it's definitely worth a look. And it will give you a score now based on the information you put in, and also give you advice about any potential lifestyle change you might want to make.
I'm apprehensive about doing that. I'm not going to. It's one of them. Seemed like a good idea until I downloaded it. But give us the name of the app again.
It's Healthy You. Healthy You's the app.
Healthy You.
Healthy You.
Healthy You. Healthy You.
Sure.
There we go. Get on the App Store, download it, get that, and let's say, Dan, I'm sure it will help a lot of people.
For sure. For sure.
Very much looking forward to that.